That's a fantastic point you mentioned about public private partnership. And I had the privilege to be part of one such initiative, which was rolled out by AstraZeneca back in 2014, and it's still going on. It's probably one of the largest population health management program that we have seen in the world. And that was done in collaboration with the Ministry of Health Kenya, and there were NGOs like MPAD, JPIGO, AMREF. They all came together. There was WHO, and the objective was to identify patients who might be at a higher risk of developing hypertension and how AstraZeneca could make the medicine accessible for those patients. So, an amazing, amazing cause. And it was such a great learning for me to spend some time in Africa and going door to door in remote areas and learning from the patients and looking at some of the challenges that patients face while accessing the medicine.
That's a great example you give, Kaushik, and that brings me to my other point about health equity. As we all know, health equity is something that continues to get worse and worse over the years, and essentially the difference between people who have access to medicine versus those who not continue to increase. And this is an increased area of focus, not just for me, but also all of us involved in the industry. How do we get over this challenge? How you look like or where you come from should have nothing to do with your right to health. And that's
Exactly.
essentially what we are trying to address. So, with things like tiered pricing, to make sure our pricing strategies fit the socioeconomic status and the ability and willingness to pay of the different countries, using efforts like emerging market brands, etc. But closing that gap in health equity and making sure patients around the world have access not just to medicines, but also healthcare services. This is something that cannot be done by the industry alone. This is something that cannot be done by governments alone. This does require multi stakeholder engagement and industry and governmental partnerships.